Jade, thank you very much for joining us for this, what I believe is very important interview. Um, but I'm also pleased that you will be joining us in Cardiff on Friday the 4th. So there will be opportunity for our members to interact with you directly. But I would really like to know from you, because I have known you, Jade, for so many years. You are so passionate about training and education, but you are also a surgeon. So my question is, being a very successful and a very busy surgeon, how did you develop an interest in education and training and workforce?
Thanks, Ramesh. And again, looking forward to seeing you on Friday. And I just to let colleagues know, I've just listened to Ramesh very adeptly interview my boss, Navina Evans, which I'm sure you'll hear before this, and it's influenced my thinking already. So I owe my fascination with education to India. And I went as an elective student to Madras / Chennai in 1988, and that particular experience for 3 months changed my life. And the reason it changed my life was because I became personally, consciously aware of the speed of learning that I was experiencing during that 3-month period, and also of the type of learning. So in the my previous years of education, both at secondary school and at medical school, learning had been very formal. I perceived that I was learning competence and skill, and that it was being taught to me in a didactic way. But when I went to India, I realized that really, really powerful learning comes from role modeling and challenging clinical environments. And so since that time, I've become really fascinated, both in the power of role models, but also actually more so in what makes a good clinical learning environment and how much impact that can have. And it's been a passion of mine since then, and hasn't really waned, Ramesh, to be honest.
That's absolutely amazing. Jed, you would have noticed that when I was talking to Navina, she mentioned that the experiences you have, she said, Jed, experience can also be used in frugal innovation that she is planning. And your experience in India, of course, would matter a lot. I'm just thinking the one big advantage that countries like India and other developing countries have is the patient material. There are so many patients, while especially in surgical specialties in UK, the cutting experience that is available to trainees is minimal, while in countries like India, it can be huge. So bedside education, I'm sure would be important in the planning of future workforce for us as we are thinking of global health, workforce, family, as Navina said. But that really brings me to the next question, Jed, that your role, because it's very interesting that Health Education England and now NHS have what is called Global Health Partnership for Education England, Health Education England, and you are the director for the Global Health Partnership. So, what is the concept and what is your role, and how do you see it working for the future of workforce in the NHS?
So we were originally, of course, I was asked some years ago by the previous chief executive of Health Education England and the then chair, Keith Pearson, to establish a global workforce arm for Health Education England. And the issue at that time was that we felt that we were hiding the NHS's light under a big bushel. and that we should really be having a much greater impact in the development of universal health coverage across the globe, working with colleagues and others in low middle countries as well as emerging economies and developed economies. What's become clear to us over the first 3 or so years is that the key to all of this is partnership. And if we are going to achieve sustainable growth, which provides value for money, healthcare and universal health coverage across the globe, we need to work as partners. And what I mean by partners is within an environment that allows mutual benefit to arise. Because one of the things that we've learned from the colonial experience, Ramesh, as you know, is that going in and having a unilateral approach to health capacity building in other countries simply does not work. It's non-sustainable. It very often irritates, quite rightly irritates and disturbs relationships between individual healthcare workers or partners or institutions, and it also creates an arrogant sense and an inefficient way of building capacity in global healthcare communities. Now, the reality is, and we have to take this on the chin, that like the railway system, we may well have been the first and we may well have initially been the biggest with universal health coverage system, but we're also stuck with the oldest rolling stock. Okay, and the same is true with the NHS. And if we're going to maintain our position as a value for money, fit for purpose universal health coverage system, we have to change dynamically, and we have to change and learn from the global community. And so the way in which we have created this narrative is to say that all of this should come within partnership. And we talk about partnership at 4 different levels. Perhaps the most important one is peer-to-peer partnership. So it's the ability to have frontline healthcare relationships with colleagues across the globe, to be able to develop communities of practice with them, to bounce off ideas, to look at ideas that might work in one context that can be brought to another context. The next level of partnership for us is institution to institution partnership, and this again illustrated by the innumerable partnerships that continue to exist within the NHS, as well as partnerships like the one between ourselves and yourselves, Ramesh, which is so important. The next level up is place-based partnerships, and we know in our own system that integrated care systems and regional health authorities are really, really important in the delivery of fit for purpose local care. And by developing global partnerships with those regions, we can improve staff, we can improve frugal innovation pathways, we can improve knowledge, we can knowledge share, etc., etc. And then finally, and perhaps equally important, are government to government partnerships. And we've worked an awful lot to try and establish agreements between governments for mutual healthcare capacity building. So partnership, the key for us, which is why we've renamed the unit.
Jed, that's very, very interesting, and that sounds so good. But I'm sure it's not easy to do that. In principle, it sounds really good, but I know, and we've been working with you for many, many years, and your input globally, I've seen you traveling throughout the globe all the times. You just returned from South Africa, and your work in Uganda is so useful, and also in India. So my question to you, as I asked to Navina as well, is in changing world and the changing NHS with merger of HEE into the NHS E&I, 2 things. First of all, would you have enough resources available for your brilliant work? And secondly, how you could utilize the sort of expertise that various international organizations we have in the UK?
Wow, that's a really big question. So so let me tell you where I sit on the merger, first of all, and I'm going to talk more about this on Friday. But after an initial panic, having been through, I mean, I'm getting really old now, Ramesh,
You're not.
I've been through these circumstances so many times during my life within the NHS. But I suppose when you're in leadership positions, when there is such a big change, it does make you initially very anxious. But actually, now myself and my senior team are really excited about the prospect of the merger and what that might do for the global agenda. We have, and you will know because you participated in this, we have created a narrative over the last decade or so, which says that you can't deliver high quality services locally unless you think globally. You cannot do it. And it's clear to us that the NHS is definitely buying that narrative more and more and more. And therefore, that presents us with a real opportunity in the merger to do more in this space. There are clearly financial challenges to that. And that, of course, again, if I was a glass half full person, I would say that is pushing us towards looking at issues such as improving productivity through frugal innovation, which was mentioned beforehand. And I think there are real opportunities now for us to open the door, looking at increasing productivity on a value for money, on an increased value for money basis, and the emphasis is there. But I think partnership, again, is one of the keys to this, Ramesh. And the conversations that I've recently had in South Africa, for instance, have all been with commercial companies and third sector large-scale funding agencies, recognising that we need to pool our resources in order to be able to expand and grow the global agenda. And then the final thing I would say, and I've been saying this a lot in recent months, is if you think about the really big issues that affect healthcare and will affect the healthcare of generations to come, our children and our children's children, they are around climate change and sustainability, global health security, health and well-being, an appropriate workforce, and affording universal health coverage and equality, diversity and inclusion. None of these things, absolutely none of these things, can be done as a single country or as a single entity. And therefore, it's irrespective of what the naysayers may say about the global agenda is not only here to stay, but it must expand. It's the only way we can survive.
Oh, that's great. Thank you. But, Jade, part of my question was, we have healthcare staff from almost 180 countries. So the whole globe is represented in the NHS. Do you think you can use this resource for the benefit of the global healthcare workforce family?
Yeah, Ramesh, you're quite right. And Navina mentioned, and I said at BAPIO conference last year, if you recall, and Navina mentioned experts in our midst and recognising. I mean, we've done an appallingly bad job at trawling the intellectual property of our international graduates in the healthcare system. It's been not only have we done an appallingly bad job about using what they have in addition to what we have as UK graduates, but we've also gone out of our way to make their lives uncomfortable at times. And I think we increasingly need to recognise that. Going back to your first question. I passionately believe, and I say this every time, that if you move a healthcare worker from one health economy into another health economy and then bring them back again, they come back as a better healthcare professional. With diaspora and international graduates, they've already worked in that other healthcare economy. So why are we not utilising that much more? And so, yes, we do. And I think we need to be positively discriminatory, actually, towards diaspora communities to get the ball rolling and to get our existing healthcare processes and organisations to understand exactly what they're missing by not engaging the diaspora properly.
That's great. Thanks, Jade. My final question is about your personal life, well-being. How do you look after yourself?
Well, sometimes I don't think I do, Ramesh. And sometimes I do. Lockdown was great at the beginning of it because I became healthier than I'd been for many years beforehand. It's a question that I'm really considering at the moment, to be honest. And May I just say that as she's now not on the line, that Navina is an extraordinary inspiration in this regard, and many other regards actually, about thinking about how you can maximise your internal strengths for the benefit of the health and well-being of myself, my staff, the workforce within the NHS, and more importantly, by far, the population of all the populations that we serve, and I think. I do probably need to do a bit more work on that. But I do walk a lot. I play golf. I try and wind down as much as I possibly can when people don't keep dropping things into my diary. But it is a commitment of mine over the next year or two to get more of an understanding, and I'm using Navina as a bit of a role model for it.
Thank you very much. Golf and walking sounds very good. Jed, we look forward to welcoming you on Thursday evening, and thank you for all your support that you have been giving to BAPIO over all these years. We also look forward to seeing you at the BAPIO conference in India, and thank you again. Thank you.